So how's it going, guys? So this is Dr. Sa at Specific Chiropractic, providing Gonstead Chiropractic in Manhattan, NYC. So we have a special guest over here, okay? Yeah, registered nurse, okay, med surg. So clearly, fill us in. What's going on?
So I've been having this pain, sciatic pain, for the past 15 years.
Mm-hmm.
And it goes from my back all the way to my my heel.
Mm-hmm.
And like sometimes I cannot even walk, lay down, or do anything at all.
Gotcha. Mm-hmm. You've also been having hip pain as well?
Yes, a lot of hip pain on both sides, especially when I'm working out. It's on the left side though.
Left side.
Mm-hmm.
Also, what about the right side?
The right side is on the back and the left side is in the front.
Left side's in the front.
Mm-hmm.
Got it. All right, let's have you take a walk over there. Straight line. Keep on walking. Other than the increased Q angle, which usually comes from an EX, from a PI, EX or PIX misalignment, if you heel very carefully, the way she was heel striking, okay, with the AS ilium side, which is what the right, her right hip is, it makes a leg longer. So therefore, her heel strike would be earlier and also a little louder noise. As in, you had a little more louder thud every time you step with your right foot versus your left. Whereas your left foot, because your left leg is a little bit biomechanically shorter due to that pelvic, posterior tilt, it makes a little softer thud when you heel strike. And also a little later strike as well. So that's what I'll see in the gait itself. So yeah, now everything starts pointing out, I said, okay, so we got the increased Q angle, a lighter thud noise, and also a later heel strike, Gillet's test, we're about to find on that one. We're going to correlate that with the x-rays, all exam findings. That's what we want to be very sure and confirm that, yep, that's the left hip we really need to address. You go ahead, march in place. I want you to march like this. Okay, so we already see something going on to the viewers, is that you have a very increased Q angle. Your leg is supposed to be going straight this way, but your left leg is going way over to this way. I was also seeing that while you're walking as well. So going based on the history, and we got the hip pain, left side worse than the right, okay? And also out of curiosity, your daughter's 3, right?
Yeah.
So during the pregnancy, usually, let's say, when did the hip pains really start to get worse?
After delivering my baby. Mm-hmm.
Okay, but during the pregnancy itself, roughly what
Yes,
week?
when I was about 20 weeks pregnant, I couldn't even walk more than 5 steps. It was very painful.
Gotcha. Kind of figured that. Okay, so the reason why is because, as you get pregnant, right, and if you have a weak core and the baby's still growing, the pelvis starts tilting forward, right, and the way your body starts compensating, you start to go into that external rotation position. So that's what I'm already noticing with your left hip over there. And so it doesn't surprise me after you get delivered at birth. And on top of that, since it's your first birth and delivery, it twists and torques that pelvis even more. All right. So we're going to tie it all together with that history in mind and take a look at the x-rays. And I already see that due to a full shadow way over to the left. And then also with the ringing effect of that left ilium over there. And with the gait analysis, as we saw, and with a quick mini Gillet test, there's some areas that I'm just not surprised about showing up. And we're going to confirm with this instrumentation over here, because basically what's going on is this: when tissue gets damaged, it starts that inflammatory process, increasing vascular supply to introduce more white blood cells in the area. And the increased vascular supply, the byproduct of that is going to be increased heat. And that's what this device picks up. Now, in addition to, there's going to be more swelling, edema, and also more muscle spasms to help protect and stabilize the joint itself. And we can see this is all puppy here. It's all fluid. Tender right here?
Yep.
Yeah. Right here?
Yep.
Right here?
And not really.
Here?
It starts there.
Yeah, that's pretty bad EX in there. Right here, not too bad?
Yeah, no, that was worse.
This is worse, huh?
Mm-hmm.
Okay, now let's just check it. See, that's a brick wall. That is not moving. See, it's moving decently. Yeah, this sacral segments is, see, this right hip, it's actually moving too much. Pain here?
Yep. Mm-hmm.
But not really jumping out.
Mm-hmm.
Okay, so we're going to keep an eye on that in the future visit there. Not too bad. Right there, just sinks. Right here. It just sounds differently too because it's all filled with fluid here. That's not too bad. And this is not happy either. That's cervical. Okie dokie. Yeah, it's moving just fine. Okay, just the right, please. Just the right leg. There you go. Once more again. Keep on going. Good. Keep on marching.
One leg?
No, just the right.
Oh.
Just the right. Keep on going. Keep on going. Keep on going. Okay, just the left. See, every sacral segment is moving just fine, but you can relax there. So what I'm seeing here for the viewers as well, okay, on your PSIS, they're moving just fine. That's what normal is supposed to be. However, over here on the PIIS over here, it's supposed to move underneath, like this way, but it's not. Her left one is moving diagonally outwards. So that's an external rotation. And that also explains why she had the increased Q angle as well. So this is the one we need to address right now. Once again, this gluteal fold shadow line is supposed to be smack in the middle between the previous symphysis, but you can see it's way off to the left. All right. In addition to, yeah, we're starting to see this winging effect over here. This is a little more blade-like compared to the right side. And on top of this, we also see your sacrum is very anterior. A normal angle, I want to see that 45-degree angle over here, not an anterior, sacrum like this. And on top of all that more fun is the fact that, yeah, we have a posterior open gap wedge on that second sacral segment over here. This is something we need to address in your future visit. Keep an eye on that because this fellow over here, that's what's explaining why you had that left inguinal groin pain over there. Right? Correct. So that's what that fellow is all about. So in other words, we're going to choose our battles. But right now, is that left hip. That's more symptomatic and more acute. And we need to address that one first. And then I'm going to double check to see what's going on over here. In essence, what your body will start doing is it start twisting up like this. And over here, twist that way, twist this way, and twist that way. All started from there. That's why the untangle started from this end. Because with all that twist like this, multiple twists, you can try to work in the middle, but it's just going to go right back to it. No, it makes a lot more sense. Let's work on right on one end first. Mm-hmm. That's where it started off. That's what we're going to go with. Okay, come on up. Go ahead and walk up and down the hallway.
Yeah, I feel better.
So tell us, what's different?
The pain is not there anymore.
How's
Wow.
right hip?
Much, much better. Yeah. Wow.
Pretty cool, huh?
Yeah. I'm surprised.
Well, it's biomechanics actually. So
Wow.
even though you were explaining, says, hey, what's going on? I have a lot of pain on the right hip, but the real problem's on the left. So it's almost sort of like that, that from that movie scene from My Cousin Vinny. So basically, if this gets stuck, okay, if your left hip gets stuck over here, okay, how are you supposed to walk? Right? Your right hip has to move a lot more to compensate for the stuck left one.
Mm-hmm.
So if this is moving way too much, what is going to happen? Yeah, it's not gonna be so much fun. So I wouldn't be surprised you feel more pain. So that's why it's important, in the Gonstead Chiropractic, methodology, we don't always chase pain. We want to find a real problem and go address that.
Mm-hmm.
All right? Pretty wild stuff, ain't it?
Yeah.
Okay, let's do the delays. Go ahead. I'll give on marching. So see, now it's becoming more symmetrical.
Yeah.
Yeah, so instead of being very straight over here, and this is going over here, now we have a more balanced Q angle over here. Another thing, I don't know if you notice, okay, now both of your heels, the heel striking is much more symmetrical, and also, even you can hear the sound is much more symmetrical too. You don't have that little louder thud with the right foot, and a softer pat with the left foot. Right there. So basically what going on is this. When I took a look at x-rays, I want these ribs to be symmetrical over here. But it starts out with the 7th dorsal over here. These ribs is no longer symmetrical. It's like one's lapping off on the other one. That 7th dorsal, that's what we need to address next. Drop the belly. A little more. Relax shoulders. Let it drop. There you go. There it is. Okay, come on up.
Yeah, that's better.
Tell me, what's different?
There's no pressure on my shoulders anymore. Yeah, it feels more lighter.
Nifty, huh?
Yeah.
Tell us now, what's going on with the right wrist?
I've been working out and I started feeling pain in my right wrist.
Mm-hmm.
It's very sore. I cannot bend it backwards.
Go like this for me, please. Yeah, go like this. You can see it to the viewers as well over here. No problem going here, an extension, but
There is pain, yeah.
yeah, it's pain, right? So let's take a look first. Elbows. Okay, see. Yeah, this is all right. Yeah, there's the fixation right there. So we gotta address this lunate. But first things first, I have to clear that traffic jam in your neck. I want to make sure you have proper nerve function flowing from your brain down to your neck, to the shoulder, elbow, and into that wrist itself. All right. Okay, come on up. Now check the wrist. What's different about it?
A little better.
How much better would you say?
Like 70% better, yeah. Wow.
I said, that's why it's so important.
Yeah.
We had to remove that traffic jam out of your
Actually,
neck.
it's getting better. Like, yep. Wow.
Pretty wild, ain't it?
Yeah.
That's why, again, it's so critical. You got to get all the information from your brain into that wrist. Now let's go ahead and take a look at the wrist. Okay, so your lunate is out. So we got to address this one first. Okay, so this is. That's what we're talking about. You knock your thumb out too. Good. There's your thumb. Okay, go ahead. Try the wrist.
Yeah. Wow. Yeah, feels great. Yeah, no pressure anymore. Feels very good. Thank you.
Oh, you're very welcome.
Yeah.
How's the thumb?
Yeah, I don't have any pain anymore.
Nifty, huh?
Yep.
Oh, that's what all it takes.
Wow.
Oh, thank you. Okay, so your homework is this. I need you to ice that left hip of yours. That's key. 20 minutes, 3 times a day. Okay, same thing with your neck as well. Okay. And on the following visit, we'll keep an eye on that second sacral segment, and we'll address that whenever it's ready. Okay? All right, you're all set. You're welcome.
Thank
Have a great
you.
day. Okay, so give us the latest updates. How's everything coming along?
I'm still having a little bit pain, but it's like 75% better than before. And I was able to walk like 15 blocks or more yesterday. Usually I can walk only 2 blocks and I'm already in pain, but yesterday I walked like 15 blocks and I came back home and I was like pain-free.
Nice.
I was very, very happy, like satisfied. Thank you
Nice.
so much.
Oh, you're very welcome. Thanks for the updates.